Right. So members, change of venue, but we are not changed. We are the same. We are the champions. So let's bring in some more energy. Good morning again.
Good morning.
Great. So let's welcome Dr. Professor Dnyanesh Belekar. A big round of applause. Sir, and thank you very much, Arunji, for inviting Sir here. And Sir, we are very grateful that you are here today. From your precious time, you are giving us some information today which will be very helpful for us, right? So, everyone, I'm sure we all are laymen in medical field, but still, do you know what is a gastroenterologist? Right? Gas hota hai sabko gas, right? But it is a very specialized field and a very important thing to know that how important it is to manage our digestive system, right, sir? So, without much ado, I'd like to introduce Dr. Dnyanesh Belekar. And sir, please, if you can come and do the needful. Sir has around, if I start reading what qualifications sir has, it will take 30 minutes, but I think around 22 qualifications, right? So the most, in fact, in our chapter, Vinay is the most educated person, if I'm not wrong. And sir, he's also got many qualifications like SSC, HSC. What all have you done, Vinay? BCom, yeah, and PT. Personal trainer. So yeah, so let's welcome sir and over to you, sir. Thank you.
A very good morning to all.
Good morning.
I would like to first thank Arun Deshmukh sir for bringing me into this particular diaspora of elite members, and very much thankful to all the club secretaries of BNI Champions chapter. Today I have been given opportunity to speak about something related to my specialty, that is gastrointestinal services. Now the word may sound a bit technical as such, but he has already simplified my job by mentioning something related to gastric system, that is a digestive system, and right from the throat it goes to the last part. And it is actually a very huge or a vast topic to compress it rather actually in 45 minutes, but I will just try to see how much justice I can make it. So I have just given a different terminology to this particular topic, right? Rather than directly jumping into the GI services, that is the abdomen of Pandora's box. Now we all are aware what is a Pandora's box. So it is something goes with a myth that brings some bad luck or evils to individual as such. And but here also what happens, many times the individual is not well prepared for handling various illnesses or various symptoms he or she is suffering from, and then suddenly they have to consult the specialist, they have to take the opinion, they have to understand what is happening, and then they can find the remedy for the same. So this is how we are going to go forward. Next slide please. So it is just in short whatever I have just spoken. So I will just mainly mentioning about the part, that the last line, that is the abdominal part with which everyone will have some or the other complaints, some or the other time in their lifespan, because that is what is we are mainly made up of. And as the elderly say very wisely, you are what you eat. Okay, so how sattvic you eat, you become that particular person. How tamasic food you take, you become that person. It is very, very basic, and it is straightly connected. It has nothing to do with any religion, it has nothing to do with any ritual things. It is scientific. Whatever you eat, you will become. It is but natural. So you eat healthy, you think healthy, you will remain healthy. It is the basic motto for this. Next slide is just a picture of showing what all parts we are looking for here, and mainly the GI system apart from the liver part. Next slide please. These are a couple of slides are a bit technical, so please bear with me. So these are just for simplicity. The part of the abdomen is divided into two compartments. What we usually refer to as abdomen is a part of the peritoneum. Now peritoneum is a covering within which everything is encased in our abdomen. So it includes the entire intestinal tract and the solid organs, what we know. Two mainly, there's a liver and spleen. The other part, that is the extra or the retroperitoneum, that is slightly behind the abdomen, that is the GU system, that is the kidneys, ureters, bladder, that is behind the peritoneum, and the lymphatic system. Now everyone will have some or the other understanding of these systems. They are all clubbed together, but they are slightly separated in our body, and they will have different manifestations and symptomatology. Next slide, please. So this is in nutshell what is a GI tract, what you understand by. So we have two distinct differentiations, that is the upper GI tract, which is mainly comprises of the food pipe, that is the esophagus, and the stomach part, or we call it that in other words jathar as such. And the lower GI tract is divided into two main components. One is the small intestine and one is the large intestine. Now this everyone you must be aware of. The other side components, the subcomponents of the small intestine are again into three parts, that is the duodenum, jejunum and ileum. Now this itself part is almost comprising of 18 feet. Okay, so this is slightly all twisted and into the abdominal cavity, cramped up nicely, but without having any issues whatsoever to any individual. Then the large intestine starts from the cecum. It is a junction between the large intestine and the small intestine, and it is a part where the appendix is attached. I'll come back to it later. Then comes the ascending colon, the transverse colon, the descending colon, the sigmoid part, the rectum and the anal canal. So this is entirely is the GI tract. So you can understand, if I go in the depth of each, it will take a lot of time. But still I will try to touch the most important aspects or other points pertinent to these all structures. Next slide please. Again just a picture showing this is actually the GI tract, starting from the food pipe till the anus, entire thing. Next slide please. So I will start with the esophagus, that is a food pipe, simplest thing. It is where we eat food and the food is propelled into the stomach. Okay, it goes into the stomach by the peristaltic movement. So food pipe is not like a iron pipe. It is not just a straight pipe. It undergoes with peristaltic movement. So the food gets propelled from the mouth as you churn and you eat inside, you swallow it inside, and from the pharynx it goes inside by the peristaltic movement, slowly into the stomach part. So now in this there are again two types of features one can encounter. One is a benign, or in simple words non-cancerous one, and second is a cancerous one or a malignant one. So what are the non-cancerous symptomatology everyone may encounter is the regurgitation, or simplest word is the burping. Every day someone or the other will have some side of a indigestion, uneasiness, something coming up, burping, retching symptoms. Heartburn is another common term, that is it is called as. So majority will have this typical type of features, especially when you eat a lot of oily food. You go to functions, we eat something which is a mixed variety, which the GI tract is not used to it, and when you come home then you feel uneasy, lot of gaseous distension, burping, uneasiness, something that is coming out again and again. That is a typical regurgitation symptom, that is what happens. Second pathology is the achalasia cardia. Achalasia cardia is a type of a motility disorder of the esophagus and the stomach junction. So the esophagus fails to propel the food from the food pipe into the stomach. There is a neural block into that particular small section, which makes it quite lethargic and spastic, or spastic means hard. I will use simple terms so for you to understand. So it becomes a little non-responsive and it doesn't open, and it should open and propel the food from the food pipe into the stomach. So the food remains in the esophagus, so you feel a heavy sensation in the chest, lot of bloating, and one cannot eat beyond certain point, and he or she might vomit or puke also, because at certain point it becomes full, and that is a big issue. So heaviness in the chest is a typical symptom with which these patients present to us. Third thing which is non-cancerous is a varices. Now you may have seen in few movies or other some of your relatives maybe, that sometimes one individual may vomit blood. Okay, so vomiting of blood is a typical hematemesis, a technical word which means it is because of the varices. Varices is nothing but the blood vessels that are surrounding the food pipe. They becomes bloated because of the excess of intra-abdominal pressure into that particular system, and at one point of time it just gives way and the patient starts bleeding, and it is a catastrophic emergency. Now the bleeding can be of different types. It can be a minute bleeding, a small ooze, it will just one episode and body will take care. But sometimes the variceal dimensions are large and then it becomes difficult for it to get controlled by itself. So then the patient needs to be attended in the emergency, in the casualty, and then needs to be addressed properly. Fourth thing is a stricture. Stricture is nothing but a narrowing of the food pipe, right? So the food pipe which is undergoing peristalsis, it narrows for a pathological reason. Now what could be the reason for this narrowing? Narrowing could be due to various reasons. One of the commonest thing that can happen is usually when someone ingests poison, right? Poison or phenyl, you may have heard about it in the news. So it damages the entire inner lining and it actually burns the entire inner lining, and eventually the body heals by contracture or narrowing, in a simple words. That is called as stricture. So the patient is unable to swallow, he or she may not retain any food, will be continuously vomiting. That will be the picture of a stricture patient. Next comes the diverticulum. Diverticulum is nothing but an outpouching. So this is a food pipe. There is a small outpouching that comes. So the part of the food remains into that small balloon, which is a side part, and it gives a weird sensation to the individual. Something that is there, something is not going down very easily, and I'm feeling uncomfortable. So that is a typical picture. But diverticulum in the esophagus per se is not that problematic as compared to the colon, which you will see later. Lastly is a hiatus hernia. So you must be aware of hernia, right? So what we see hernia usually is a groin hernia, by and large, what we understand. But hernia can occur internally like this as hiatus. So hiatus is what? It is basically an aperture between the diaphragm which transmits the food pipe into the abdomen. So at that particular junction, it becomes lax, and because of the raised intra-abdominal pressure, it gets pushed up, and the entire stomach part sometimes comes up and goes down. So that is how it becomes a hernia. So again the symptoms will be typical of something getting bloated or something coming into the chest, some weird sensation, heaviness and vomiting, of course. So these all are the benign pathologies related to esophagus. Coming back to the malignant one, there are two things. One is the Barrett's esophagus. Because of the excess of maybe the cold drinks, other strong drinks, hard drinks, it causes the damage of the inner lining at the junction, and it leads to the pre-malignant condition. Barrett's esophagus is technically a pre-malignant condition, and it actually changes the entire inner lining, and it becomes slowly tight. And the patient will present initially with the same symptom like achalasia, but if you do not notice it by doing endoscopy, one can miss it. And lastly is the cancer esophagus. So a cancerous growth can happen in any part of the esophagus. Most common is second and third part, because that is a part which is more dependent and at the level of junction. So there is a more chance of that it coming up and it is causing problem. So this is in nutshell about the esophagus. Next slide please. So now I have added few images for you to get clarified in your mind regarding what are the happenings. So first thing what we spoke about is a regurgitation. So in this picture one can see what happens. This is a junction which is vulnerable. The entire gastric acid sometimes comes into the food pipe and it becomes extremely vulnerable and difficult for one to adjust that. So this is a typical acid that is thrown up into the esophagus or food pipe, and that leads to the typical burning sensation, regurgitation, heartburn, choking sensation. Next slide please. This is again in continuity with the regurgitation. We call it as a GERD or a gastroesophageal reflux disease. It's a typical symptom which leads to a sense of something which is, you feel like vomiting but you don't vomit. It's like typical nauseated feeling. The stomach is full, there's a lot of gas that is going up, and there's a lot of acid also that is passing up inside. And usually happens when actually because of the lifestyle change. Okay, so during our daytime when we have lunch, we do not have any problem per se. We digest food well, we do not have that much digestive issues. The main issues happen in the night time or during the dinner time, because all of you are busy entrepreneurs, and we all late, we reach home late, we eat food, and then there is not much of an activity, physical activity per se. So what happens, we either sit in a couch or maybe sofa, spend some time with the family, watch television, speak something, just spend some time and then go to sleep, go to bed. So the time between the food intake and the sleep is very, very narrow. And that is what leads to this typical symptoms of GERD or heartburn or reflux. So the time of your dinner and your bedtime has to be at least 3+ hours. Plus there has to be some activity, some little activity, not I will say strenuous physical activity, but like a small walk or something for 5-10 minutes. That will ease out the symptoms, because there is no physical activity that particularly happens in the night times beyond the dinner time that is going to relieve you of the symptoms. So the more late you eat, the more symptoms this will have. And usually we call it as a sort of a couch syndrome, or when you sit on a couch and have a television, you're gulping something, eating, watching movies with family, and then you sleep. That is what typical things starts happening. So this is typical GERD. Next please. This is one upper part is a varices part, in which I have shown that blue things are the dilated veins or the vessels containing bad blood or deoxygenated blood from the heart. They are bluish in color, and the one which is oxygenated are red, that are arteries. So these veins are grossly dilated across the junction that gives the symptoms of vomiting of blood. And these are the endoscopic pictures. On the left side, one can see is just a beginning. A small bump is seen at the one part at maybe 5 o'clock. Then at this second picture, you can see 2-3 components, one at 6 o'clock, 9 o'clock. The bulges are slightly increasing in size. And the last image showing a gross dilatation or gross engorgement of these channels, which is quite grade 3 or grade 4 varices. These bleed a lot. Next. This is a stricture, which is nothing but a narrowing, which happens post-caustic damage or post-acidic damage. There is a typical narrowing of the part of the esophagus. Patient is unable to swallow and pass the food. Next please. This is a typical diverticulum, a small outpouching because of the excess pressure, and it gives small bulge, and it gives like a small balloon and some symptom of something that is remaining in the part of the body but not going out. Next please. This is a hiatus hernia. Now this is a normal left side picture showing a normal hiatus. Hiatus means nothing but an opening. Okay, so opening part is normally there, so it will contract, it will relax. But here it is dysfunctional, it becomes broad, and the part of the stomach goes into the upper part, that is the chest, and that becomes a hernia. So it will go down and go up. That is how the patient will experience something which is bloating into the chest. Next please. This picture is showing early part of the Barrett's, in which there is a lot of, on the A part you can see a normal lining. While you go on moving out, there is a hiatus plus there is a reflux, which leads to the change in the epithelium or the inner lining of the lower part of the esophagus. Next please. This is the endoscopic picture of the malignancy or a cancer of esophagus, which is of different types. In B, one can see a small nodule. In C, it's like a donut, which is quite grossly enlarged. And D, it is a large growth in passing the lateral wall. Next please. So this is in nutshell, I have tried to summarize about the food pipe or the esophagus. Next we'll come to the main part, that is the stomach, which has the largest reservoir where actually the food gets accumulated, food gets churned, food gets grinded, and food gets easy to pass on into the small intestine. So it is the most dynamic part of the GI tract, and you all are aware a little bit about it. I'm not talking about the physiology, I'm talking about the pathological aspects. So again, divided into two parts, benign components and malignant one. The most common symptomatology for the stomach part, one can have one, is an ulcer, or we call it as dyspepsia. So typical symptoms will be indigestion, gaseous distension, as I mentioned very much rightly, gas. Then patient will feel bloated. Food means, see, there are two types of ulcers. One is here and one we will see in the, when you start a small intestine, that is a duodenum. But they are very close to each other. So in this ulcer, we call it as acid peptic. So in the part of the stomach, which you have seen in the figure, the ulcer starts and it erodes the inner lining of the stomach. Stomach usually is quite thick as compared to the small intestine. So it takes time to actually erode or take a part of it. So it's a prolonged issue, a prolonged problem. And in this, typically what patient will have, the symptomatology I've already mentioned, that whenever he or she eats food, immediately after eating food, he or she feels like vomiting. Okay? He or she cannot retain food and it becomes quite distressing to eat food. Uncomfortable feeling, painful feeling into the stomach, that is a typical of a gastric ulcer or a stomach ulcer. As against to a duodenal ulcer or a small intestinal ulcer, which is having a similar picture, where one individual will mention that he or she will feel better with having food. There are two types of symptomatology, please understand. In the first symptomatology, in the stomach ulcer, the patient will have pain when he or she will ingest food. Now, how it will happen, the food particle will directly touch the ulcer base and it will irritate it and it will cause severe pain and the patient will feel relieved by vomiting. In the other part, patient will feel better with the food. It is not, the basic pathology doesn't change, it is a timing. The stomach and the duodenum part is a part and it will take some time, at least couple of hours, from food to go from stomach to the duodenum. Till that time, patient perceives the timing is just prior to the next meal. Understand? So patient feels that the food actually helps him or her because the timing is such, it coinciding with the next meal of that particular individual. So he or she perceives that I feel better by ingesting food, but that is not a part. It is actually the pathology happens same, but the timing difference that leads to this particular sort of a sensation. Second thing, again the same varices. Here also we have the stomach varices in the upper part where patient bleeds quite profusely. Now here, because the part is quite roomy, there is a lot of area, so it will take some time rather than esophagus where there is not much of a space for expansion. So the symptoms will appear quite fast, while in stomach part it will appear a bit later. Then third thing is a polyps. Now what is polyp? Polyp is nothing but a small outpouching in the inner lining of the stomach. We'll see with images so you'll understand better. Then the obstruction. Now the stomach can get obstructed in the last part or the part which it connects to the small intestine, and then patient will feel severe choking sensation, bloating feeling, vomiting, inability to retain food, and the patient will have a lot of issues with it. Fifth and sixth are absolute emergencies related to stomach. So fifth is a volvulus. Now what is volvulus? Volvulus is nothing but a simple rotation of stomach. Now stomach little bit free compared to esophagus in the chest can undergo little bit lateral movement or the movement which is little sideways, which leads to slightly rotation and sometimes twisting in simple words. So in volvulus it gets twisted either this way or that way, which we will see in the image. That again leads to severe vomiting and it is emergency, we need to address fast. And last is a perforation. The ulcer which is present there, if it is prolonged or if it is too deep, it will actually perforate through the entire wall of the stomach and the acid will spill into the abdominal cavity and patient will have severe pain, severe vomiting, extremely uncomfortable feeling, and it is absolute emergency which we need to operate at the very early time. Then coming to the malignant conditions, the CS stomach and a lymphoma. Cancerous stomach is again a continuation of a prolonged ulcer. So 3 to 5% of the ulcers, they eventually land up having a malignancy. or a cancer, or for that matter other entities also lead to CA stomach, such as the food, various beverages, smoking, genetic, and lifestyle all leads to CA stomach formation. Next slide please. Now this image will give you an understanding about the peptic ulcer or a stomach ulcer in simple words. So this is the ulcer which has eroded the inner lining and created a small gap into it. Right? Next please. Now these are the varices or the dilated veins as we have seen in the esophagus, but only thing is now it is in the upper part and it will take some time. These are the various grades which you need not pay attention much, but important is there are various locations which lead to the bleeding. So the bleeding will change, the quantity of bleeding will change, the magnitude of the problem will change, and the gravity of situation will change. Next. These are the typical polyps. These are the free small swellings with a small stalk that is attached to the stomach, and these polyps can be removed endoscopically. That is a good thing, and they do not cause much of a disturbance with a little bit sensation of something there into the stomach. Next please. This is an image showing the obstruction or a blockage to the stomach outlet, which leads to sort of a block or a stop into the food that is getting propelled into the small intestine, which leads to stomach distension, which leads to regurgitation, that is a vomiting, and lot of discomfort to the patient, again an emergency. Next slide. This is what I call it as a twisting of the stomach or the volvulus. It will go twisted either this way or that way, either way, depending on how much food bulk or how much motility one individual carries into it. Next please. This is a perforated ulcer, the ulcer which you have seen earlier. That is a breach in the stomach inner lining that leads further, and the entire thickness of the stomach wall is breached and leads to perforation. It is nothing but an opening into the stomach that leaks the acid into the abdominal wall and abdominal cavity, and that is a quite emergency for the patient. Next please. So again same thing, repetition. Next. This is a typical picture of the early gastric cancer where it is localized only in one part. Again you can see the picture which is similarly to the gastric ulcer. Initially ulcer starts, the irritation keeps on continuing over a period of time, which leads to stomach cancer. Next please. These are the images endoscopically of the stomach showing various types of a growth at different levels in the part of the stomach, which can be slightly bulged or it can be a quite big large tumor. Next please. That is in short about the stomach part. Then we come to the small intestine. Now small intestine again three parts, and these are all various symptoms. Now small intestine being a very large food pipe as such, it will have different symptoms. Ulcers we have already spoken, polyps we are aware. So main part is ileum, where actually the other issues start. So I will concentrate on the ileum part. That is the polyps. Again they will have a similar picture. That is because small intestine having a little lesser aperture will have more pronounced symptom as compared to stomach, which is a quite large reservoir. So this polyps may lead to some block in the food intake and food propulsion. So that leads to slightly feeling of indigestion, something that is causing some block into the part of the intestine, but the patient is unaware what is happening. So some problem with the digestion. Second thing is a tuberculous ulcer. Now TB affects, besides the chest, which was the earlier affection, extra pulmonary affection. That is the commonest is the GI tract and the genitourinary tract, that is the kidneys and the lymphatics. So here the ulcers are typically in the ileum and they are arranged in an oval shaped manner, and patient will have atypical symptoms of tuberculosis. These patients will not cough. These patients will have symptoms related to digestion and other issues. Third thing is a stricture, which you have seen earlier. Fourth thing is a subacute obstruction. Now it is a one step below the obstruction. So where the symptoms are not that pronounced, but patient will have some or the other intermittent problems with indigestion, he or she will vomit and will lose weight. So that is a time when one has to remain alarmed that there could be some subacute type of obstruction. Commonest pathology again can be a tuberculosis, or it can be some small band that can cause a problem. Then comes the commonest that you are all aware is appendicitis, which is nothing but a small extension of the entire GI tract at the level of cecum. That is a junction of a small intestine and large intestine, which we'll see later. Obstruction is a mechanical obstruction of the food pipe. So it can get just obstructed and patient will have emergency. Patient will have lot of distension of the abdomen, vomiting, pain, and patient will have less passage of flatus later on. Perforation, which is similar to a stomach perforation, and lastly malignancy. Next slide. So this is an image showing a stricture, that is a narrowing in a part of a small intestine, which can be corrected in a surgical manner with this simple procedure. Next please. Now this image will show various types of problems suffering from appendicitis. The commonest, the left side one is acute one, where the appendix is inflamed and one needs to operate on emergency basis. The next two are also important, that is a gangrenous and with fecal impaction. See, being a terminal part, which is a blind small loop, some food particle will remain lodged into that particular small appendix, which leads to a small fecodith or a stone formation because of the fecal matter or food particles gets concentrated, and that leads to obstruction. And then patient can have a different type of picture, like a large abscess, or it can be a simple surrounding the abscess of appendix. So various symptomatology patient may present to you with appendicitis, and believe me, appendicitis is one of the most threatening problems one can encounter in a lifetime. It is very easy if the patient comes in time to the surgeon, and it is very difficult the patient comes late, misses it, and comes with some complications. It becomes difficult. Though appears to be a very simple entity, it can cause catastrophic problems to individual. Next please. This is just an X-ray showing an acute obstruction. So what this patient will present to you with: abdominal distension, lot of vomiting, severe pain, discomfort to the patient because of the mechanical obstruction of the small intestine. These are the typical picture which is showing air fluid levels at the in the part, and this is the picture when the patient is lying down, which will show a typical pattern of image. Next please. This is a typical tuberculous perforation of a small intestine. This will lead to a typical leakage of the intestinal content into the bowel, which will be lot of causing peritonitis and severe agony to the patient. Next please. These are the enteroscopic pictures of the part of the small bowel, which are showing polyps, and lastly showing malignancy. Next please. Then we come to the last part, that is the large intestine. Now various benign pathologies can happen in a large intestine, such as the simplest thing being a constipation, that is right below, then the bleeding, then the hemangiomas, like small tumors which are nothing but a ball of capillaries or blood vessels that leads to severe bleeding, and a lot of blood loss. Patient will become anemic, patient will be having a lot of weakness. Then the polyps we have seen. Colitis is nothing but the inner inflammation of the inner lining of the colon or a large intestine that leads to this problem. Irritable bowel syndrome. Now this is one peculiar pathological entity that disturbs the individual, which doesn't fit into any particular category. It is not a proper mechanical obstruction, it is not a classical colitis, it is not a classical diverticulitis, but it is just irritates the inner lining of the large intestine, and that leads to typical symptoms of uneasiness, bloating, pain, and slightly disturbed bowel movements. That is typically called as irritable bowel syndrome. And treatment for the irritable bowel syndrome is also symptomatic, but is not very specific because the symptoms will vary from individual to individual. It is not the same. Then the Crohn's disease doesn't happen so much in our country, it is more predominant in UK. Intussusception is the channeling of the earlier part of the colon into the next part. You will see in the image, you'll understand better. Diverticulitis is the same, volvulus is nothing but again the twisting, and last two things is same, obstruction and perforation. So we'll try to understand each by the imaging part. Next please. Now here what I mentioned earlier in the esophagus, the diverticulums or the outpouchings. This is a typical diverticular disease. Many individuals may be suffering from this, but they are totally unknown to it because it is not causing much of a problem to that particular individual. But the part of the food is getting accumulated at each part of this outpouching or small balloons, and that leads to irritation, that leads to a sensation of pain, discomfort, altered bowel movements, and slightly agony to the individual. So this is a typical thing which we have to rule out by ruling out other entities. Next. This is a typical picture of intussusception. So it's like a food pipe. First part is going inside the other part because of the sheer indifferences in the pressures. First pressure is high, the next pressure is a little low. So it will telescope into the next part. And it will have typical symptoms of severe pain, something which is getting choked inside the small intestine or the large intestine here, and vomiting. And it can be in earlier sort of timeline, can be treated conservatively, and in later part it requires surgical exploration. Next please. This is a typical hemorrhoid or piles that one can suffer from. Next please. This is a typical volvulus, and it happens mainly at the sigmoid part of the colon, where it is lot of free movement it is available. So it just undergoes twisting, and that twisting will lead to typical acute emergency for the individual. So we need to derotate the entire twisted colon and try to see the viability. Sometimes the part that you see, the fulcrum for the twist, it can become gangrenous, and then we have to entirely remove the entire portion, because if it becomes gangrenous or dead, we have to remove it. If it is non-gangrenous or not dead, one can intervene and salvage it. Next please. This is a typical picture of a volvulus, which is large gas that is getting bloated. Patient feels a lot of choking sensation. It is huge abdominal distension, and patient will have severe pain. Next. Now these are the stages of the colon cancer. So earlier part is just a breach at the level of the mucosa, that is the inner lining. Next, as the tumor will progress, it will infiltrate into the surrounding lymphatics. Once it has breached the outer lining of the colon, it is considered as an advanced malignancy. Okay, so it will reach to the other systems, and we call it as an advanced disease. In the first point, 1 or 2, it is a limited disease and can be treated with acute surgical intervention and timely intervention. But 3 and 4, it is a relatively advanced disease and requires a systemic treatment such as chemotherapy or radiation therapy and sometimes immunotherapy. Next please. So this is in a nutshell. I tried to cover all the symptomatology related to GI tract, right from the food pipe till the anus. Then important point for us to know, what are the investigations pertinent to these various pathologies. So far what we have seen, at least 30-40. So the basic most starts with the ultrasound of the abdomen. Okay, so if anyone has a problem with digestion, any problem with the picture which are coinciding with a similar thing, one can have a simple sonography of the abdomen and pelvis, and one can detect majority of the pathologies with this. Second thing, depending on the symptoms, the doctor or the surgeon may subject one individual for either upper GI scopy or a gastroscopy, or a lower GI scopy or a colonoscopy, where the problem lies. Third thing is an enteroscopy. It is a elongated gastroscope that goes into the small intestine and sees majority part of the intestine. Fourth is fifth and seventh. At 4 to 7 are little outdated type of investigations. Why I have included them? Because they are important ones, and that will give you, it's like a small contrast they will give you to swallow to the patient, and they will take serial pictures, and where the part of the colon gets filled will get proper images and the picture will change. So this barium swallow for esophagus, that is a food pipe, meal for the stomach, meal follow through for the small intestine, and enema for the large intestine. It will differentiate and pick up many pathologies, and it will be very helpful. But now with point number 8, that is the CT scan, computed tomography of the abdomen and pelvis with contrast, it has virtually replaced all these point number 4 to 7. Then we have one advanced, that is a capsule endoscopy. It is nothing like a big capsule which one needs to swallow, and the capsule will take serial images right from the swallow part, that is the esophagus, till it expels from the anus. So it is a advanced technology. The capsule is just passed, it passes and transfers to the entire GI tract. It will capture various images and gives beautiful images of various minute parts which are other missed by the simple endoscopy, because endoscopy is a little bit rigid thing. Though it appears flexible, it cannot capture everything in 360 degrees. So this capsule endoscopy is a good, it's like a small drone that is going inside you and getting captured or capturing the images. Last two is a sigmoidoscopy and colonoscopy plus biopsy, because one means sigmoidoscopy is done basically just to diagnose the condition, but when there is a suspicion, we take a small punch of tissue and we send it for a pathological study that will determine whether it is a cancerous or non-cancerous. Once it is non-cancerous, then you are free of any tension, and then further treatment can be given. And a colonoscopy. Next please. So this is an image showing a simple gastroscopy or upper GI scopy, where the part of the food pipe, stomach and early part of intestine can be picked up with direct vision, and we can take a biopsy from it, and we can diagnose many conditions with this. Next please. This is a typical colonoscopy. The scope is a very long one, passes through anus under anesthesia, and it reaches till the part of the cecum where all the things can be seen, such as stricture, intussusception, polyps, growths, Crohn's disease, everything can be picked up, and we can take multiple biopsies from various sites, and it is very useful thing. Next please. Now this is a capsule endoscopy. Typically that particular micro camera is fitted into the small capsule, and it transverses right from the esophagus till the last part, and it is painless, no sedation is required. It is just like a swallowing of a pill for you, and it is very helpful, but it is a slightly costly thing, but yes, it is important. Next please. Now these are the laparoscopic or images when we do a diagnostic laparoscopy, where various pathologies. On B you can see the appendix problem, on C you can see the bands, on D one can see tuberculous seeding into the abdomen. So a diagnostic laparoscopy, put a scope in the abdomen and visualize various pathologies that can be picked up. So that is a possibility. Next please. So coming back to the treatment part, of course the treatment is individualized. Though we have a set guidelines, but a treatment which is suitable for one individual may not be always suitable for the next individual, because everyone's body physiology is different. Please try to understand this. Though there are certain common things. Suppose I suffer from dyspepsia and you suffer from dyspepsia, treatment is same offered to you both, but the response what I will give and what response you will give will be totally different. It is your body's physiology and body's response mechanism that will determine. So please remember this, the treatments are standard ones, they are available as such, but the response is, or the treatment one needs to individualize. Coming to the conservative line, what is conservative? That is most important. It is a non-surgical treatment. Simplest, as I mentioned earlier also, diet and lifestyle modifications. So some sort of a discipline is must for individual to avoid all these problems. So diet, again I said healthy diet which is rich in citrus, antioxidants, fresh food, no canned food, no stale food, the food which is packed, food which is there for a long time, to be avoided. Fresh food once eats, it will be very safe. Lifestyle modification, as I mentioned, the timings. It's very important that a few of you may have encountered these problems of indigestion when the timing of the food changes. When you have dinner at 9 o'clock daily and suddenly one day you have dinner at 11 o'clock. The next day you start having the problem because the body clock, everyone has a body clock inside, everyone, which is individualized. That body clock is set as per your own discipline. Now, if you discipline your body clock, say breakfast at 7, lunch at 1 o'clock, say evening dinner at 7 o'clock, and you follow this ritually for last 20 years, your body is set for that particular response. So body is aware that this time food is going to come, I have to come into action. But for some or the other reason, you are busy, you do not have option for food immediately, you are or getting whatever food you want to eat, then it disturbs the clock, and that clock disturbance is the first stage of getting acquired various diseases that we see. So a lifestyle modification, and preferably, if possible, maintaining the timing of the food intake is very, very crucial. Medicines, there are so many medicines depending on the treatment, the symptoms as such. Semi-conservative, like endoscopically, we have, which is therapeutic, like a polyp. So polyp one can diagnose as well as remove also endoscopically. Diagnostic laparoscopy I have shown in the last image, one can identify various pathologies and one can come to conclusion and do certain investigations. Laparoscopic surgery like laparoscopic appendectomy, laparoscopic cholecystectomy is not technically part of GI tract, it's a part of HPB, that is hepatopancreatic biliary system. But yes, for common person it is a part of a GI tract, so laparoscopic cholecystectomy. And the robotics. The robotic is helpful mainly in the pelvic part or the lower part of the abdomen. Third component is a surgical, where open procedures I have shown. For a small intestine, a stricture is cut and it is sewed again, and diameter is increased, so there is no blockage. And for cancer, one have a chemo, radiation or immunomodulation or immunotherapy as such. So what is important in nutshell is these are the various treatments, but it will vary from individual to individual and the pathology. Your state of mind will make you healthy or unhealthy. So you have to think positive, make the best of whatever you have with a good food intake, with good discipline lifestyle. And of course your daily work need not change per se, but just to instill a little bit of discipline into it will help almost remove a lot of problems from it. One more important part I would like to just highlight is adequate intake of water. Okay. Now many of you may or may not have intentionally or unintentionally reduced the water intake for some reason, which you all know best. So that leads to directly the problems of indigestion, gastric distensions and other problems. So have adequate water intake of at least 3 to 3.5 liters a day, because 70% of the body is made up of water. So if you lower your water intake, it will deplete the reservoir of water in the body. That leads to directly weakness, lethargic, uneasiness, lack of concentration in the given topic that you are studying or doing it at hand. So if you want to replenish your gut flora, it is important that you also drink a lot of water simply, and a lot of juices, fresh juices, not a canned one, the fresh one, without any ice or any masala per se. And you can have a lot of curd in the daytime, a lot of buttermilk, that is also healthy practices. So these healthy practices will keep you healthy all the time. And lastly and most important, it's a mindset. That is what will keep you happy. So you have to think positively whatever you have, that yes, it will make yourself happy. So whatever little you have, you can remain happy. You don't need to have a very high-end things just to keep you happy. So thank you so much. So happiness is a state of mind. You have to just see. You don't have to have a very high-end phones to make yourself happy. A simple frame of mind can teach you happiness. So thank you so much.
Thank you so much, Dr. Belekar, for this. Make us understand that gut is the most important, or at least that's where it starts and ends. So yeah, thank you so much for that. And this is just a little token of appreciation.